Hi everybody, a little over a week ago I had a hysterectomy, so I figured since I'm bored and have nothing to do, why don't I share the whole journey with y'all? Let's start with why I have to have a hysterectomy. I had to have a hysterectomy because I have several fibroids. She said it's like if I'm 5 or 6 months pregnant, so you know a chick wasn't never gonna get a flat belly. So, and I'm almost, oh my gosh, I'll be 40 next week. So I'm not having any more kids. I have one daughter, ain't having any more. So I figured let's just go ahead and let's just get it on out. Let's get it done. So I did do a laparoscopic procedure, but because the uterus was so large, they had to also give me like a C-section style like incision. It's like this long. And so because normally with laparoscopic, if your uterus is small enough, they'll pass it through your vagina. But she had to take it out through that incision. So I have 4 holes in my abdominal area. I have 2 on this side. I have 1 incision through my belly button, and then I have 1 on this side, as well as the C-section style incision. So for those that have fairly large uteruses like me, you're probably going to be having to go through a similar process. Other women that I've known, like my mom, for example, her uterus wasn't that large. She had a hysterectomy maybe like 5 or 6 years ago, but she just had the laparoscopic holes and it went through the vagina. So hers wasn't as invasive as mine. I actually feel pretty good. It's just that incision, that C-section incision is what's giving me the most like soreness and pain. So if you know you're gonna do it, I would say definitely do some sort of like a clean eating type thing. I do drink lots of water. I'm a big girl, side note. I'm a big girl, you know, but I am a massage therapist. I'm on my feet a lot. So I'm an active big girl, you know, but I do drink lots of water. That's one of my saving graces. And I do think that me being pescatarian since basically the end of August has really helped the recovery process. So that's just something to kind of maybe know. So let's begin with the prep. So a lot of things that I did for my abdominal area is I did kind of massage it. I have this little stim unit a client purchased for me. It's a wireless stim unit, and I did that in my abdomen area, and then I would do cupping. I did cupping on my stomach. If you have access to cupping, or if you know a therapist or someone that can do it, I would highly recommend doing some massaging, some stim, and some cupping on that area, you know, a month or 2 before, just to kind of help like get the process and get your tissue ready for that major, because this is a major surgery, you know, especially if you're doing it how I had to do it, is a really major surgery. So you want to get it prepped and ready to go for that. Okay. All right. So let's begin with some of the things that I purchased to help me get ready for the surgery. So I didn't have any like house slippers. So I did order these house slippers from Amazon. They are super comfy. I love them. I'm wearing them all the time since I got them. And they were like roughly like $20 some. So definitely a good investment. Also, another thing that I ordered is these packing cubes. Oh my gosh, they are the best thing. And my toiletry packing cube, which I love. And the fabric is actually pretty good, and I like the color. Let's just go through some of the stuff in my toiletry bag. Okay. So we have the lip chaps and stuff, which is very important. Potpourri. Any essential if you're traveling. It came in handy in my room. You get this from Bed Bath & Beyond. Potpourri. Everybody should have this in their home. I have a little mini brush that I got. Gum. Gum comes in handy, especially if you don't feel like eating anything, but you want like something to kind of chew on. Had me some gum. Little mini underarm deodorant. I have these clean slate wipes and because honestly, I did not take a shower when I was in the hospital. I was in the hospital almost 3 days. I was ready to get out of there, but I could not pee. So we'll get to that in a minute, but I couldn't pee, so that was a little bit of a hassle. But those are like key things in my thing, but just whatever you feel. I mean, I even had like this head wrap that I had put, but instead I brought shades. I literally wore these shades, to be exact. I wore these shades to the hospital. I had them on until they were wheeling me back to surgery. One, because I was slightly scared and I didn't want it to show in my eyes, and there were some times where I kind of wanted to cry, but because I was so scared, and I kind of a little bit cried before we left, before they actually wheeled me off, but I kept these on until they wheeled me to go to surgery. So I think they thought like I was like a diva or something. I don't know. And then when I came back to my room, because I knew I was going to be looking toe up from the flow up, like worse than I looking. I knew I was going to look a mess, and I did. So I wanted to keep these on because the last thing I want people seeing is like my major bad raccoon eyes with no makeup at all after surgery, and it is not a cute sight. So if you are not going to pack one of these, or even if you do pack one of those, pack some shades. Pack some shades, either this kind that are dark or something that's like big shades, because that way even if people come over, you can't really keep a face mask on your face if people come to visit, which means they're still going to look at all your roughness. So pack some shades because it helps, okay? This was the next size that I used. So in here I had my underwear, my no slip socks. So no slip, like these kind of socks. The hospital has socks, and you know, which I pretty much had on the whole time. Again, like I said, at the hospital, I did not take a shower while I was there. I literally just slept. I was up trying to walk and then trying to pee the whole time. And then, and then you're sore. So I didn't even use any of my underwear there at the hospital. I didn't actually use any underwear or the socks until I got home. And then once I got home, I took a shower and did all that once I got home. Which this bag is so cute because it has like basically 2 compartments. So it has the main zipper compartment that stuff goes through. Then there's another mesh other zipper in the front. So in that I had a lot of my electronic stuff. So I had all of my chargers. So let me show you. I had 3 portable chargers, not only for myself but for people if they came to my room. So I had a mini hub. This is the mini hub, and it comes with it comes with an Android and a iPhone attachment like on it for both of these. And my charge is one of my favorite portable chargers because they last. Like even if you don't use it, it maintains the charge until you use it. So this is good for 1 full charge, and it charges pretty fast too. But this is good for 1 full charge. Then I have another My Charge device. It has I forgot what kind of adapter this is, but then it has an Android, but then it also has a USB at the top to put whatever chargers. And this is good for at least 2 to 3 charges. Then I had this charger that I got, which was good because you push this, it'll give you like the percentage that you have left, and then it could charge up to 2 devices. But this charge is probably a good, if it's 100%, if it's at 100%, charges at least 4 good charges, 9 good charges. So this was pretty good. So between myself and people that were at the hospital, that came in handy. And then I also packed an extra iPhone charger. And then I had my Apple Watch. This is a travel Apple Watch charger, which I didn't even use because I decided last minute not to even take it, but they do have these little travel Apple Watch things if you do want to take yours. Then I had one more larger cube, and in that I had this robe, which this is like a medium thickness robe. So let me see, I'm a little sore, let me stand up. So it zips all the way down, but it was good because I could put it over my I put it over my hospital gown, so when I had to go walk, I didn't even have it zipped up. I had it open and I was able to, I just put it over because you know your hospital gown is open to the back, but I was able to walk, you know, around, and I use this robe a lot. I got this from Walmart. It wasn't that much either. And then I also from Walmart, which I have a lot of the items that I purchased, it's in the description. But what came in handy, and I'm actually gonna send my daughter to go buy me a few more of these, is they're like PJs, they're like drawstring PJs. I got them like pretty big on me, but they're so loose and they're not like sweats where you have to, you know, the band on the sweats can push against your incision, which is gonna hurt. But this I can like adjust to how I want. And when I was in the hospital, I actually wore these pants one day to walk around because, like I told you, I'm a big girl and I did not like my thighs touching. So, and I actually wore this to the hospital. I wore those pants the morning of the hospital. It came with like a really thin, breathable shirt, and I wore this and a very thin type of pullover jacket to the hospital. And then when I left the hospital, that's what I put on when I left. So definitely get that. Ordered a body pillow. The body pillow has been amazing. It came in handy. I bought it actually a month before my surgery, and I fell in love with it before. And then I bought a grabber. It's retractable, which I haven't actually taken it apart since I've had it, but anyway, it comes apart or whatever. But this thing, handy. So get this grabber or a grabber like it. This was like this was a cheaper grabber, but it works just fine for me. I also got ice pack. One ice pack I already had. Sorry, I just got it out the freezer not long ago. But it has the Velcro, and you can either put it like around, but it helps with the incision. When you first put the ice packs on, even now to this like day, I'm gonna end up putting one on after I'm done doing this video. But my abdomen is a little swollen and numb, so I really don't feel it. But I put it over, I have like, say this thin type shirt. So I have my underwear, I will actually have the shirt down. Then I have the underwear kind of high. Then I put the ice pack over because you don't want to put it directly on your skin. You don't want to get frostbite. And I also have this one right here, which it opens up. So sometimes I actually just have it like this, and I'll put it over the lower part of my abdomen, and then the hospital gives you basically like a waist trainer type of cincher. And I've been using that most of the time. I've been using another one of mine, which I'll show you in a moment. But this, and then it also opens up. So sometimes, and it's a bigger coverage. So, and I'll either put the whole thing over, or if I just kind of want to isolate it to that one area, I'll just open up one, or sometimes I've done it like this too. So ice packs. Ice packs have helped with the swelling and the pain. So I highly recommend getting some ice packs. Okay, also I had got some, I have some strips, some scar strips that haven't came in, but I also got this. It's like, this is called ZÜCA Solution, ZÜCA Tape, which is what I have that I'm using for this scar right here. The transparent dressing is over it, but I put this on. And what's cool about this is that it can break off. It's already has the pieces are already cut, so you can tear off the piece like individually, and even if you want to like cut the cut them even more, you can. So that part I really like. So I ordered these. So far I like them. They had good reviews on online, which is why I got them. Another thing that I purchased, which I got from Walmart, is Band-Aids. Got different Band-Aids, ointments, these I used when I came home and I took a shower for the first time. I actually had my mom help me put it over the incision, over the my C-section style incision. They use this surgical glue, so they don't want you putting oils or lotions or anything on it or anything like that, but they do want you to kind of like let the soap, kind of like the soapy water run through to clean it, and they just want you to keep it dry. I have my 2-week post-op coming up, but I used this the first couple of times I took a shower, and just to cover it. And also, the first day I was in the hospital, super doped up on morphine, I was on a liquid diet, and they gave me peppermint tea. And so the tea I drank, but they had it so hot, and I spilt it on myself and basically burned. I have a burn here. It goes down to like the side of my boob.
Why would it make the water that hot, first of all? Second of all, I'm on medication in a hospital bed. Why would they give somebody that scorching hot tea and they're on drugs with potentially a chance of spilling it on themselves? Why? I mean, I'm just saying, if I had a wristband on that indicated that I was a fall risk, wouldn't it be common sense to know that if you give me something hot, then that I'm a spill risk too? I mean, it makes perfectly good sense to me. But what do I know? So now I gotta take care of my wounds that I have all over my belly area. And I'm treating my burn wound.
Again, I used the hospital stuff, like the gown and the underwear while I was there. But like I said, order you some granny panties. Granny panties that kind of like go over your belly button, because you're not going to want anything. If you have to have an incision like myself, you're not going to want anything low hitting it, because it's not going to feel good. And then you kind of want them over the laparoscopic holes too. So all the granny panties I got kind of went a little above my belly button, which have been great. I started wearing different panties the past few days, but I think I'm going to go back to the granny panties because they're just more comfortable. I don't even care aesthetically what it looks like, because it doesn't even really matter. Also, I got a few gowns, like zip-up gowns that I've used here at the house, but I didn't even use them at the hospital. I did pack one zip-up gown, this robe, and then the outfit that I wore to the hospital. It's just comfortable. It's all about comfort and you healing, okay? So that's what's important. The morning of the surgery, they're gonna ask you to do an enema. Went to Walmart and I got the Fleet enema, but then I also saw this. It's basically like a water bottle. You can fill the water bottle up. You can fill the water bottle up. And this is the small one. They have a douche attachment and a enema. It's basically the old school way they used to do douches. But they have an anal attachment, so you can give yourself an enema. So what I did is I did 2 cleansings this way, and then I waited like 30-45 minutes, and then I did one more cycle of this, and then I did the Fleet enema to get like whatever's the last stuff in there. If you haven't had a colonic or you haven't had this done, them first 2 cycles, Also, thanks to one of my best gay guy friends, he gave me this, which the link is in the description. He gave a very detailed kind of cartoon thing on how you should clean your anal cavities, but it's just good information to know, like if you just want to have that area cleaned. I mean, I'd say it's pretty thorough. So the link is in there for your information. Well, let me talk about the day I go into the hospital. So when you go into the hospital, you're going to do all your check-in and everything. You are going to do all the prep work. I know because my nerves were so bad, I was feeling nauseous. And so they gave me this sort of like it's like a sticker. If you tell them before you go back that you just feel sick and you think you're going to throw up, which I think you should do it anyway, just because you don't want to be feeling nauseous or sick after surgery, and the last thing you're going to want to be feeling or doing is throwing up because your stomach's going to be sore and hurt. So they gave me this sticker that went behind like my ear, and it was going to help with the nausea, which it did actually. And then, but they don't want you touching it, because if you touch it and accidentally touch your eyes, it can mess with like your dilation of your eyes. When you come out of surgery, they had these compression type things on my lower part, like basically over your ankle, calf sort of area. And then I already had a body binder. Mine, it's very simple. Mine is right here. It's just a simple white one that the hospital had already had on me. That's the main one that I've been using. I just started using the past few days this one that basically hooks in like so, but then it also has these straps that you can put to like make it, you know, tighter or whatever. But because it's the glue, it kind of like pulls on it a little bit, so you just got to be careful when doing that. But I have been wearing this binder like every day, so it's helped with the swelling of my stomach go down, which is good. So even though it hurts, you're going to want to keep it on. I wouldn't definitely not go like a day without wearing it. There may be times like if I want to lay down, and plus you want to keep it low, like around your hips. You don't want to have it high up like by your ribs or anything like that. You want to kind of keep it low where it's going over your hips and your lower ab area where your uterus is supposed to be, just to keep all the swelling down. Okay, so that's going to be key, because you don't want to go to sleep with that high up on your ribs and all that. It's going to give you some other issues you don't want to have. I was on a liquid diet the first day. Then, like I told you, I had to walk. I didn't pee on my own. Obviously, they had the catheter in me for that day. Then they took it out, maybe like after 12 hours or something. I walked around. They wanted to see if I could pee. If I couldn't pee by a certain time, they were going to have to straight cath me. I was not able to do that, so they had to straight cath me, which does not feel good at all. Then I kept walking, kept doing, I try to stay up and walk around and be mobile, because it does help with the healing process. You don't want to just be laid up in bed and not moving. That's like the worst thing that you can do. Not that you don't want to get any rest, because you do. You want to get your rest, but you don't want to be just laid up in the bed, like, because you want to get the blood flowing. You want to get that inflammation down as much as possible. But by the end of the second day, I still could not pee, so they had to stick a catheter in me again. So it would just, needless to say, it wasn't fun. I thought I was going to be able to go home after the second day, and that didn't happen. But my trick for you, if you are having trouble peeing like I was, they have these little water bottles. Get the water bottle, and I filled it with warm water, and I sat, and then as I was trying to go, I was kind of like squishing my area, like my pee hole area, to see if I could go, and that stimulated it and it helped go. So I would definitely use that as something to try, because it worked for me. The first time I went very little, It's a really little bit. And then the second time I did really well. They wanted me to go 3 times. I had to go 3 times and measure, I think it was more than 300 or something like that, in order to be released. But let me tell you the downside of coming home. Well, not the downside of coming home, but the worst part of the whole process is I did not have a bowel movement until 5.5 days after my surgery.
And the icing on the cake as to why today has been the worst day post-op is I haven't had a BM. I actually haven't had a BM since the morning of my surgery. And the lack of that occurring has created a tremendous amount of pain and pressure in my abdominal region. And I think I've been doing just about everything I can feel I gotta go, but I can't. But hey, if any of y'all have suggestions, I'm more than welcome to try anything at this point. Because just walking is very painful. I've never wanted to shit so bad in my life. I hope this video was helpful. Thanks for watching, and good luck on your recovery.